Hello, everybody. I see a few people signing on. You can put in the chat where you are from. We're expecting quite a number of people on this call tonight. So I see Greenwich, Wilmington, North Carolina, St. Paul, Minnesota, from Atlanta, Texas, Cambridge, Massachusetts, Kentucky, Seattle, Washington, Long Island, New York, a neighbor, Ramona from California, Huntington, West Virginia. Welcome, everybody. Ohio, another one from New York. We'll just wait a few minutes to let other people sign in. Faith from Flint, Michigan, and New Jersey. Another Texas representative. Another person from Georgia. One of those advocates asked me to set back the webinar. Lauren, can you the actual webinar link? We have Virginia. Okay, we'll see if we can get that. There's Jessica from Colorado. Kristen from Boston. And Colleen from North Carolina. Colleen, I know, has been at the in-person meetings, with several other names here that I thought have been to the in-person events. All right, why don't we get started here? So welcome everybody to the Marfan Foundation Virtual Capitol Hill Day Training webinar. I'm Dr. Josephine Grima, and I'm the Chief Science Officer for the Foundation. Pre-COVID, the Marfan Foundation held several in-person advocacy days in Washington, D.C. Those in-person events were very successful and fulfilling for those who could participate. But of course, they did require air travel and hotel and was costly, so not everybody could participate. So this year, this is why we are trying a virtual Capitol Hill Day. It will allow more people to participate. And these meetings, virtual meetings, have become very popular during the pandemic when travel was limited. And obviously, it allows more people to participate because there is no travel. So we were very surprised, and it's been a great turnout. We have 100 people signed up for this event. So in order to handle this many people in a virtual manner, we'll be advocating with the Senate congressional members. So we will have 37 states represented. This means that your meetings with the congressional aides, you will be joined by other foundation members that live in the same state as you. But they could either have Marfan, VEDS, Loeys Dietz, or one of the other genetic aortic conditions that we deal with. So let me give you a brief overview of what this webinar will provide. We will start with effective storytelling, because this is the most critical part that you can play as an advocate during these congressional visits. We'll give you an outline of what to expect during the virtual appointment and meeting. We're going to provide you with a list of the requests that we have, and they are mainly all for increased funding for research, education, and awareness, as well as appropriate management of chronic pain, which we know that many of our constituents deal with. And then we will provide you information about the whole congressional process, just so that you have a good background of how Congress all works, and how this plays into deciding the appropriations for the next funding cycle. So we have enlisted the Health and Medicine Council from Washington to help us with these congressional visits, and I'd like to have them introduce themselves to you. Catherine, do you want to start?
Absolutely. Thanks, Dr. Grima. Hi, everyone. I'm Kat Cruz. I'm a legislative consultant at the Health and Medicine Council. And shout out to everyone from Texas, because I'm originally from Texas, but I am now based in DC. So thanks for having me.
Thank you. Joshua?
Hi, my name is Joshua Fine. I also work at the Health and Medicine Council in Washington, D.C. As a legislative associate. I'm really excited for, this kickoff webinar and the Virtual Advocacy Day taking place next week.
Thank you. So I also want to tell you, believe Joshua sent out a legislative packet to everyone this afternoon. So you can take a look at that. The Health and Medicine Council helped us put together that legislative agenda. The first page is really sort of like a cheat sheet that you can have with you during the actual visits. It gives the run of show for those meetings, and it provides concrete bullet points for the asks that we are doing. It's short and sweet so that you can just take a look at that. But if you want to learn more about the issues, the Health and Medicine Council has put together issue briefs about each one of the congressional asks that we're doing, and you can read that on your own. And if you have any questions, you can certainly get back to me with those certain questions. So if anybody has questions about this webinar, or while we're doing this, you can certainly put questions in the Q&A box, and we will answer them at the end of this webinar. Now I'd like to introduce our Chief Marketing and Communications Officer, April Dawn, and she's going to tell us how you become an effective storyteller. So April?
Thank you, Joe. So first of all, thanks to everybody who signed up for this. We know we have folks who have lobbied in person or virtually in the past, and folks for whom this may be your very first experience. But the main takeaway I would love you to have tonight is that your voice matters, and that all you really need to bring along to this experience is your lived experience. Whether you are somebody who's directly impacted by one of the conditions we serve, whether you're a caregiver, a family member, a partner, a loved one, a parent, or you're a provider, the fact that you've had personal experience with Marfan, Loeys-Dietz, VEDS, or a related condition is really the number one thing that you bring to the table in the interactions you'll have with government officials. And sharing your personal story, as the slide outlines, really gives you the power to influence support and create change. Your number one goal in interacting is to make an emotional connection, right? The esteemed folks we have with us today, members of our staff team, will really help you with kind of the factoids, the asks of the government officials. That's really not your particular job or role as you go into this. And folks that are comfortable with those things certainly can take that role on to a degree. But the number one thing you want to do is tell your story and make a connection. And I try to leave everybody with an idea of 3 things if you ever feel sort of stuck in the middle of one of these sessions. You're really telling a story of self. How are you directly impacted in some way by one of these conditions? Why do you care about these conditions? How have they impacted your life? So some sort of self-focused story. A story of us, that can be the impact you've seen to our community. That can be the impact you've seen to your family. That could be the impact you've seen to your patients or your health system. And then a story of now, which is when you really kind of transition to the help of our staff team and our wonderful consultants that we have with us tonight. And that's explaining why it's so important for these government officials to act now and support legislation, support funding that is necessary to advance our cause. So if you can remember those 3 things, a story of yourself, a story collectively of how this impacts a larger group, whether it's your family, whether it's our community or health system, and a story of now, that way to transition to kind of the special facts of the situation that you'll get some assistance from our staff and consultants. Joe, if you can go on to the next slide, that would be great. So what is advocacy, right? It's exactly what it sounds like. It's a coordinated effort by grassroots advocates. As I said, you can have a lot of experience or no experience at all. It doesn't really matter. What matters is your passion for the topic and your ability to build that connection and really convey and tell your story. And of course, the goal is to improve our situation, right? To help get more funding for critical research, improve overall health and access to care. You're going to use your story to raise awareness and try to make some local connections. So of course, our team is hard at working, making sure we pair you up with the correct folks for whom you're a constituent. And you're really working to educate local and national lawmakers briefly about your condition. Now, the briefly part, that can be hard to gauge, especially in the heat of the moment. Again, back to that rule of 3, I think a couple of minutes. You know, if you talk about your condition, what you've experienced, 1 to 3 minutes on that, right? Kind of that story of us, how it's collectively impacted your family, your friends, your community as a whole, again, patients or healthcare, again, a couple of minutes, and then kind of transitioning. So you're really looking at a short talk. You don't want to rush. You want to feel kind of relaxed and calm in the sort of cadence we're all sharing here together tonight. But if you keep that in mind, a couple of minutes for those 3 pieces, I think you'll be in really good shape. Can move forward, Joe. And then, you know, how do we collectively make an impact? One advocate, of course, is powerful. Every story we have is powerful, but when we unite our voices together, we can really be an influential group, right? We can take our mission and carry it forward to folks in our government. So they don't just understand on paper or understand a request for funding, but they sort of understand in their hearts, right? There's things we can all relate to. We can relate to having loved ones we want to help. We can relate to wanting to help our communities, can relate in some cases to wanting to help our children, our patients. So really it's about bringing your voice and then all of our collective voices of those many stories together to influence change. And, you know, they have power too, right? They have the power to help make decisions that affect research, treatment, coverage of things like out-of-pocket costs. Joe has alluded already to the idea of pain management support. So really just know that what might seem like just your small individual voice is really not small at all. It's a very powerful way to take your lived experience and develop an emotional connection with someone who may have never known about it, known about these conditions, known about you, had you not stepped up to the plate by participating in this program and really sharing your story and what's important to you and why there's such a deep and critical need to fund the things that matter for our folks living with these conditions, their loved ones, their providers, and the foundation as a whole. So Joe, I will turn things over to you with that. If anybody has any questions for me, you're welcome to put them in the Q&A. I'll also place my an email to reach myself, the Marcom team, in the chat. If you think of any questions between now and the event, we're happy to try to help you work through those. Joe?
Great, thank you. So let's go on to understanding a little bit about how these meetings are being scheduled. You all should have, I think most of you might have received a calendar notice from Joshua with the meeting invite Zoom link that you're going to meet with your Senate congressional leaders. These meetings are all going to take place between 9 a.m. and 5 p.m. Eastern, but for those on the West Coast, we'll skew a little bit earlier. And the meetings will be in the Zoom format with the healthcare staff aide, and will take approximately 15 to 30 minutes. So just to go over a run of show, in each and every meeting, there will be a Health and Medicine Council member at your meeting. If I can be in that meeting as well, I will try to get to as many as I can to be a representative of the foundation. We'll have the Health and Medicine Council kick off the meeting, introduce the issues that we're there for. And they will ask every participant to introduce themselves and where they live. You want to tell the legislative aide that you are a constituent and that you are living with these conditions that have minimal treatments, right? And tell your story. You should tell the aide, you know, that funding research and education and awareness is really going to help, you know, researchers and physicians find solutions for your condition. Remind them again that you're a constituent and that you're also part of the Marfan Foundation community, and that we're a family of communities with related conditions, all suffering from really devastating outcomes, for especially for people that are undiagnosed, and there are no real true treatments for them except for surgery in certain cases. Provide the HMC staff will provide them with the specific legislative asks and a leave behind for them. And then you should just be thankful to each of the staffers for their time and participation in helping this. So what are the asks for the congressional visits? Again, more funding for research, education, and awareness, and appropriate policies for pain management. These are the specific asks for numbers, and you know, we'll leave that up to the HMC staff to provide that. I don't feel that you have to remember those numbers. If you want, they're on that little cheat sheet. You can obviously talk about them and discuss them. So, but why are they important? Just so that you know, our researchers, provide, look for research grant money from the NIH. The Marfan Foundation funds seed grants, but they are only small grants. They're $100,000 over 2 years. The scientists use that seed money to develop preliminary research results so that they can apply to NIH for a lot more funding. Researchers apply for grants that are sometimes 4 years of funding that can cover, $3 or $4 million. And that takes a project a very far distance. The issue is that when NIH doesn't have the funding it needs, the pay line for certain grants gets less and less. So, for example, if NIH can fund their budget allows them to fund the top 8% of the highest ranked grants. If a grant comes in for our condition at 10%, at the 10% ranking, that grant is still meritorious. It's still a good grant, but there is no funding for that. And that's the only reason it doesn't get funded and go forward. So this support for NIH is really critical for our researchers in order for them to continue to get funding. Support of the CDC. The CDC provides a lot of information for education, awareness, prevention. They look to develop healthcare policies, and it's an overall budget that we are looking to support in order for them to continuously conduct their research. Catherine, do you want to add anything more to the CDC description?
Sure. So, they also take a lot of what is, translated or like discovered at the NIH and they put it into practice. And they also release recommendations and guidelines on opioid usage as well.
Great, thank you. And the next part is really for a $6 million for a program that is at the CDC. And it is for more education and awareness programs. And this is more like a sort of a grant program. Is that correct? So that patients, advocacy groups, and physicians can join together to apply for funds really specifically for education and awareness of the lay population and physicians. And this can greatly benefit us. We have the opportunity to apply for these types of grants, and it's certainly something that we will look into in the future, but we want to make sure that they keep the program in place and make it available so that we have that opportunity. The fourth ask here is to include vascular malformations in the DoD Department of Defense funding budget. Again, it's another venue for our physicians to apply for funding. This is it's a funding program that will benefit people that are in the Army that suffer traumatic experiences with vascular injuries, but we can learn from each other. And so our conditions, especially rupture of the aorta, how to deal with those, it really gets covered under this. And so it's another great area for our docs to apply for other funding if they can't get it from NIH. And the last thing that we are looking to ask for is appropriate policy for chronic pain management. We all know that there has been changes in opioid treatment, but so many of our patients have chronic pain, and if they can't get the opioids that they require, they're looking for alternative treatments. Some of those alternative treatments are not covered by insurance then. So it actually gives more burden on the families. And it's so difficult to live with pain every single day. And we just want to make sure that when they are considering those policies, that they really take into consideration all the other benefits or ways healthcare can help to cover some of these alternative treatments. So I think I'm going to pass it over to Josh to go over how this stuff works.
Thanks, Dr. Grima. Yeah, so now me and my colleague Kat are just gonna quickly go over some just basics about Congress and more specifics about the legislative ask that Dr. Grima was talking about earlier. So that Congress is divided between two chambers. So we're going to be meeting with the Senate side. Each senator gets 6-year terms. There's only 2 from each state, 100 total. The House works a little different. It's elected to terms every 2 years with one representative from every district in the country, about 435. So the main significance here is that the Senate is has equal representation for every single state, each only getting 2. It doesn't differ by population. So, California, for example, has, over 50 members of the House, but only 2 senators, which is the same as, Rhode Island, Idaho, Wyoming, Montana, much smaller states. So now I'll just go over some of the most important and relevant congressional committees, for the Marfan Foundation. So first, on the Senate side, the 3 key committees are going to be Appropriations, Health, Education, Labor, and Pensions, and Finance. So Appropriations Committee, these senators are going to be dealing with allocating the budgets. So for us, we care about the most, NIH, CDC, all these different, critical like medical research on public health programs. So these are the members that are that decide how much funding all of these key, government agencies receive. The Health, Education, Labor, and Pensions Committee is in charge of oversight of health and human services. So CDC, NIH, many times they'll host hearings with, the directors of these agencies, asking them questions about, ongoing programs, key areas that they want insight in, but are also, working on bills related to healthcare overall in general. And the Finance Committee, which oversees tax laws, but also for us, most relevant is oversight of the Centers for Medicare and Medicaid Services. So any legislation dealing with Medicare, Medicaid is going to be in the Senate Finance Committee. And on the House side, it's essentially the same, except Energy and Commerce is the equivalent to the Help Committee on the House side, dealing with the oversight of the federal, healthcare agencies, and Ways and Means is the equivalent of the Senate Finance Committee, dealing with oversight of Medicare and Medicaid and tax laws. So just to go over basics on just how, passing bills works in Congress, to become a law, a bill has to pass both House and Senate, signed by the president. So this applies to every single, piece of legislation that Congress works on. Specifically, like the annual appropriations process, which is the government's, annual fiscal year bill that funds every single program, within the, the scope of the federal government. So the main thing to remember here is that the staff members and the members of Congress and the Senate that you're going to be meeting with, what they really want to hear is how they want to hear about your like local impact to their state. So they want to hear about how it's affected you, your family, your community, other people because what they really care about is knowing that okay, there are people that live in New York, New Jersey, their states that have like these conditions, and they want to understand the impact that it's having on the constituents within their states. So just to go over some just quick basics on the current situation of Congress. So Congress enters into a new one every 2 years. So currently we're in the 118th Congress. The second session, the last year, 2023, was the first session. 2024 is the second. So next year there will be the 119th Congress, the first session. So right now Republicans have a slim majority in the House. Democrats have a small majority in the Senate. So this divided nature of the two chambers of Congress makes passing, legislation difficult sometimes. And this year specifically, the appropriations process will probably be complicated due to the election. Congress takes off due to the presidential and congressional elections, where the members are going to be back in their home states, campaigning for themselves, their party, the presidential nominees. So the FY 2025 appropriations process, the funding bill for the next fiscal year, is most likely going to be delayed until after the election in November. It could possibly even be delayed into early of the next 119th Congress. But the important thing to remember for these meetings is that, a lot of the work for the final funding bill happens, it happens throughout the year. It happens with, groups putting in their funding requests in the spring, and then these requests going through the congressional process, making its way through the Appropriations Committee, and ultimately being marked up and then passed sometime either later in the year or early into next year. So these numbers that we're going to be asking for NIH, CDC, these are the numbers that legislators are going to be taking into account from the community in general when when the appropriations bill is actually finalized, some points, months or even close to a year from now. And with that, I'll pass it over to Kat.
Thanks, Josh. So continuing the civics lesson, we want to give you guys a background info on some key agencies. So first up is the National Institutes of Health, or the NIH, which is the premier research agency in the country. We work really closely with them, and they fund research that's really relevant to our community. Also included under the NIH is the Advanced Research Projects Agency for Health, or also known as ARPA-H. ARPA-H is an independent entity under the agency that supports development of high impact and breakthrough research. Next slide, please. So another agency that we work closely with is the CDC, or the Centers for Disease Control and Prevention. Like Dr. Grima said earlier, they provide education and awareness at the state and local level. And one program that we care about in particular is the Chronic Disease Education Awareness Program, or the CDA program, which is under the CDC. And it's one example of the critical education and awareness work that the CDC does. We had one advocate that I think put it in the best way, and she called the CDA program the little program that actually could. Next slide, please. So why is this information important? Well, so like Josh said earlier, Congress just finished the budget for fiscal year 2024. And what you see on this slide are the final funding numbers for the agencies, the entity, and their programs. And now that Congress has actually finished their work for fiscal year 2024, they are starting work on fiscal year 2025. So all to say, your advocacy is timely, but it's also critical that they hear your stories and what issues are important to the community. And in fact, before we move on to the next slide, which goes over the community funding and priorities, I sort of just want to emphasize that, this information that we're going to go over next is more for your awareness and your understanding of why we're having these meetings. We certainly do not expect you to memorize these asks, and in each meeting you will be joined by HMC staff, whether that's Josh or I, and we will be leading these meetings. But we want to make sure that y'all are aware, you have the background, but we also are responsible for ensuring that the staffer that you're meeting with is also understandable and is knowledgeable about these asks. All this info is also in your prep packet, which Josh sent around earlier. And to echo what April said earlier, your story is the most important part of this meeting. Next slide, please. Okay, so in a nutshell, what we're advocating for is increased funding for the NIH. The community ask is $51.3 billion. We're also increased funding for the CDC. That community ask is at least $11.6 billion. And then also funding for the CDC Chronic Disease Education and Awareness Program, or the CDA program. I do also want to reiterate once again that it is okay if you don't remember these asks. We do send this info to offices before meetings so that they are aware of all of these asks. Next slide, please. Another key ask that we also have is ensuring that vascular malformations is listed as a condition eligible for study through the peer-reviewed medical research program, or the PRMRP. So this program is housed under the Department of Defense, or the DoD, and we were really happy to see it included in the fiscal year 2024 bill. One thing that we want to ensure is that we continue to see it listed in the fiscal year 2025 bill. Next slide, please. And another key priority that we also want you to understand is that we want to make sure that the staffers are aware that we are able to ensure access to pain care and medication. So we want to ensure that patients and physicians do not face inappropriate barriers like high out-of-pocket costs or any sort of burdensome oversight. We also do support insurance coverage for alternative use of non-narcotic therapies like PT, occupational therapy, mental health treatment, and more. And you may already know this, but many insurance companies do not cover these alternatives, which in turn can prevent patients from getting these treatments. I believe that's all for me. So if you have any questions, feel free to put it in the Q&A. Thank you.
Thank you, Catherine, so much. I think we had a couple of questions about reiterating your story. April Dawn, I know you put it in the chat box, but maybe you want to go over those 3 points that you said, and we can certainly send out another piece of information so that you have that also by your side when you are doing these meetings.
Absolutely. As I said in the chat, I think the absolute easiest thing to think about if you kind of get a little nervous or anxious during the appointments is it's really 3 simple things. Why do you care so deeply about your condition, about the mission of the foundation, about the need for support and funding from the government? Why do you care personally? And whatever reason you have, your lived experience really kind of trumps everything else we're talking about here. Your lived experience is what they need to hear about, what matters. So why does this matter so deeply to you? Why do you care? Why do the people around you care? Why does this matter for your family? Or if you're a provider for your patients, if you're a member of the community, things like, coming together for things like support groups. What have you learned from your peers? So what is the collective sense of caring? So why do you care? Why does it matter for a group of caring people? Sometimes it's great to relate that to kind of the humanity of the person in front of you as well. Folks can usually very readily understand you have loved ones you care about. They have loved ones that they care about. How might you relate to what you're experiencing to kind of the more generalized experiences that we all have as human beings on our own paths and journeys through life. And then the third is kind of a story of urgency, right? Why is it important to care right now? And that's the place where if you have something to share about that, great. If you want to turn things over at that point to our consultants, to our staff partners that are with you, that's a great transition. So that's kind of the simplest way. You could also think of it in a little bit more complex terms as the story of self, what matters to you, story of us, what matters to your community, your family, your healthcare system, and the story of now. Why is it important for these folks in our government not to wait, but to act and support now as quickly as they can?
Great. Thank you so much for that, April. I see somebody asked whether we would send this PowerPoint around following the webinar. We can certainly send you the slides on this as well. But the recording of this whole webinar will be made available to you as well. So you can take a look at it, refresh your memory before your meetings. And just remember, it's, you know, you don't have to memorize all of those specifics. I mean, that gets difficult to do. But you are there to tell your story, and that's the critical part of it. It shows why we need this, when we need this, and why our researchers have to keep doing research for these conditions. We need more treatments. We need a lot more awareness and education for physicians and lay people. People don't get diagnosed appropriately. And these are all things that these agencies can help us do and provide funding for different programs that we can get involved with. So I don't see any other questions coming in. Don't see anything in the Q&A. So if there is nothing else that you want to add, Joshua or Catherine, do you want to add anything else? Well, we look forward to having our meetings next week. If you have any questions before that, you can reach me at jgrima@marfan.org. We are looking forward to seeing you at these meetings next week. Looking forward to everything. I want to thank you for your time. Oh, I see 2 new messages came in. Hold on.
I think those are just thank yous.
Thank yous. All right. Thank you all for your time, and thank you for participating in this. We know that it's really important, and we're so happy with the turnout, and you know, we want to make sure that this is a successful program, and hopefully we can do it virtually and in person in the years to come. So thank you again. Hope everybody will have a good night. Take care.
Take care all.